I'm Irwin Redlener. I'm a pediatrician by background, and I'm a professor at Columbia University at the School of Public Health, where I run the National Center for Disaster Preparedness. But I also run an organization that I co-founded with the singer Paul Simon back in 1987. That organization is called the Children's Health Fund, and that organization does health care for very medically underserved children in New York, but now around the country as well. My involvement in community healthcare in general really started in the middle of my residency, which I was doing in Colorado, in Pediatrics. And I responded to actually a poster on the wall of the doctor's dining room at Denver Children's Hospital, and it was a poster for an organization called VISTA, Volunteers in Service to America. But it was specifically advertising for doctors needed in a very, very rural, indigent county in Arkansas called Lee County. And Lee County at that point was the sixth poorest county in the United States. And even though my intention was to go into pediatric cardiology, there was something about that ad and a photograph. There was a black and white photograph of a doctor walking down an old country road towards a shack in the distance and carrying a black bag. And there was something about that and the information on the poster that really kind of compelled me to make the phone call. And I called, and the next weekend went out and visited with the people that were running this program. And I was absolutely enthralled and immediately basically signed up, canceled my pediatric cardiology fellowship, and that was it. And I spent 2 years running this medical center in East Arkansas when I was, 27 or 28 years old. And obviously it made an indelible impression on me, even though I did other things subsequent to that. That was in the early 1970s. This connection to community-based healthcare was established and very much reinforced in my early years in Arkansas. Originally, what inspired me when I was younger was the opportunity to do something that was really important in my mind in and with a population that was extremely needy. And that kind of inspiration was part and parcel in those days of the Kennedy-Johnson era of really tackling big social problems and seeing all of us participating in solving problems. And some of the people in my generation were very active protesting the war in Vietnam and doing other things, but there was a big sense that we all needed to be in the game, participating in making the country and the world a better place. So in a general way, that inspired me. But for me, the inspiration itself was never sufficient. What motivates me is really this notion of social justice. I'm just crazed by the fact that there are so many people who don't have an equal opportunity to get some of the benefits and opportunities that this society should be afforded to everyone. So my driver, in terms of a force of motivation, is a sense of social justice and wanting people to have, especially children, to have an opportunity to understand and realize their full potential. And the fact that so many don't is really aggravating for me. It's something that has driven not only my work in the community, but more importantly, the advocacy that I've been involved in for the majority of my career. There's been a trend, I'd say, over the last 15 years of creating opportunities for people that want to go into community-based primary care, say, to do as much as possible of their training experiences in settings that will be like where they're going to be ultimately practicing. So trying to find teaching sites in community health centers, for instance. I have not really bought into that concept, because I think one of the most important things for a doctor is to be a really, really good doctor, because the more out there you are, distant from the medical centers, distant from the specialists and the hospitals and so forth, the more you're, in essence, on your own. You have to be a very, very good clinical healthcare provider as a physician dealing with an underserved population. It's really the two reasons. One is that the prevalence of complex, difficult disease issues is higher in underserved indigent populations. And the second thing, there is the farther you go sort of out there in the boondocks, whether it's the urban boondocks or the rural boondocks, the fewer opportunities there are to actually engage subspecialists. So the practice in these areas is not like, in being in a well-to-do suburb where, if your patient needs a pediatric cardiologist or a neurologist that, you call up one of your buddies at the medical center and they have an appointment the next day. The absence, the unbelievable challenges getting children subspecialty care when they need it, if they're underserved, makes me really emphasize how important it is that the actual skills, the medical skills of doctors who are practicing with these populations be really second to none. And I would like you to be trained in differentiating between an important heart murmur and a functional heart murmur in a kid to be trained by a pediatric cardiologist, not a primary care doctor in a clinic someplace. So this is the kind of thing I think where my own point of view may differ from the traditional perspective on this, but being a really good doctor is step number one. Well, there's all sorts of levels of advocacy, and people that work with me and for me are involved in everything from one-on-one advocacy for a particular patient to make sure that he or she is getting what they need, to make sure a family's in reasonable housing, to make sure they get some specialty care when they need it. My own personal involvement of advocacy is on a national level because we've been working very hard to try to make sure that that appropriate policies and programs are in place that allow us to function in assuring that kids get access to health care, that every child has health insurance, that the availability of specialists, other things they need is an opportunity for all children. So I do a lot more national policy advocacy than I personally do community advocacy, although both are obviously very important.